as you might know from the links that Bob has been sharing, Dr. Madad is the director of New York's Special Pathogens Program and has been kind of instrumental in not just New York's COVID response, but our nation's COVID response because of her knowledgeability about novel diseases and how they travel. So if I can start with the first question, I've been following you on Twitter for a long time now, ever since before this pandemic started, when the Netflix documentary Pandemic came out. And recently you tweeted about your siblings also being involved in medicine and your children kind of coming to grips with the pandemic and not being able to go to densely populated fun places like Chuck E. Cheese. So this is very much like a family endeavor for you. So how are you doing with all of this, and how is everybody in your family that's involved in this handling being frontline workers in this pandemic?
Yeah, so first, thank you for that question and for obviously acknowledging so many others that are on the front lines. It's not any one individual, it's not any one team, but really it's a complete national effort. There's so many people that are on the front lines today, and when we talk about the front lines, you often hear about the doctors and the nurses, but there's so many more beyond that. And in my particular family, you know, we are a family of healthcare professionals. You know, we have a lot of physicians, both within my family, and then others that are in allied health, if you will. So it's been a very difficult situation, particularly for my particular nuclear family, and then my siblings, my parents, just because, you know, all of us are out in the field, in the community, and doing a lot of the response work. So many of us are taking care of patients, others are doing the research behind the scenes and helping with the different public health response aspects. And then even with children, I think they're taking a huge brunt, and they're feeling obviously what is happening, not just with the pandemic, but I think that we often overlook the major milestones that mean a lot to them. So particularly as you've mentioned, you know, and I tweeted about this, you know, my children, they love going to different, you know, children themed parks. So Chuck E. Cheese and all these bounce castles, things like that we were doing pre-pandemic. And they're not able to do that anymore because obviously of the situation that we're in. And while we try to explain to them, you know, there's a virus and this is why you have to do X, Y, and Z, you know, they're very tired of it. They don't know when this is going to end, and they think this is something that's short-lived. And so knowing that this is something that has been drawn out for the past 8 to 10 months, that we're going to be in it, you know, for the next few months, or at least, you know, another year. And we can talk obviously about the vaccines in a moment and how that may end the pandemic. But certainly this is taking a toll on everyone. And the one thing that I'll just mention, which I thought was funny, but, you know, I had to certainly address yesterday was I have 3 kids. I have a 7-year-old, a 4.5-year-old, and then I have a 10-month-old. And my 10-month-old was born right in January. I took 1 week for my maternity leave, and then I went right back to work because we needed to prepare our healthcare system for the eventual onslaught of cases that we dealt with COVID-19. And my 4.5-year-old mentioned to my 7-year-old just the other day, he was asking, can we go to Chuck E. Cheese? And he was asking me this question. And my 4.5-year-old, you know, he likes to eavesdrop and hear about whatever conversation's happening. And he goes up to my 7-year-old and he goes, no, there's a pandemic, stupid. And so I had to hold back, you know, my laugh because I thought it was hilarious. Like my 4.5-year-old was trying to scold my 7-year-old. I had to tell him we don't use this language in the house, but to also tell him that, you know, we're still in this pandemic. There's a lot of cases happening around us. We can't go out and do X, Y, and Z, but instead we can go outdoors, we can go to a park. So kind of level with him. But all of us are experiencing the pandemic in many different aspects. And so it's not just obviously adults, it's the children, it's school-age kids. And the last thing that I'll just mention before we can go on to the next question is you may have seen, you know, CDC, they come out with a lot of really great manuscripts and resources. And the most recent MMWR, which was, you know, last week, they mentioned the mental health toll that's happening on school-age children. And in that particular MMWR article that the CDC released, they were looking at the emergency room visits compared to last year. And there was a significant uptick in school-age children seeking emergency services to the emergency department for mental health issues, depression, anxiety, and things like that, just in the school-age children. And so you were seeing, for example, in the age group of 5 to 11, there was about a 24% increase over the last year. And then ages basically from 12 to 17, you saw about a 31% increase in emergency room visits just on mental health because of so many factors, including the pandemic. So this is taking a huge toll on all of us.
So in a recent...
Amani, let me interrupt just a quick second too, since we're recording. This is MassCom 105, Diversity in Media at San Jose State. We have our very special guest, Dr. Ahmad Madad from New York City, who's always kind enough to talk to the media. We've watched you on Good Morning America and do a variety of other things. So Amani's going to do the primary leadership in this session today. I have a student who's in a car on his way to San Diego. Be sure to ask him to ask a question about should he be going to San Diego. But let's go back to Amani right now.
So I wanted to ask, in a recent article in The Atlantic, you gave an interview and said that really, and the focus of the article was about how our healthcare system is breaking down, partially because of the mental health of people, doctors, nurses, support staff, people who have been just exhausted and depleted. But you've also talked about how important it is to keep schools open and keep them open safely. What can we do to get to a point where we're not exhausting our healthcare system, but we're allowed to keep open certain essential things like schools without risking the spread of COVID?
Yeah, so, I think with that particular question, that highlights first a number of different factors. And when you get to a point of overwhelming hospital systems, and that's what you're experiencing and seeing across the nation, you're seeing, over 30 different states, experiencing hospitalizations like never before, in this particular pandemic. And so I think looking at just the stats yesterday, you're seeing, close to 80,000 hospitalizations with COVID-19. That number is only going to increase. And the reason why I say that is because the infections that have been happening over the previous weeks and days, those are existing infections. And so what we know about COVID-19 and what we know about infectious diseases in general is that you don't see the impact right away because you have this incubation period. And so particularly when we talk about COVID-19, when an individual gets infected, it can take another 2 to 3 weeks for that particular individual to be hospitalized, should it come to that. And then it takes another 2 to 3 weeks for that particular case to succumb to the disease. And so you see this lag period. And so the infections that you're seeing over the previous weeks and days, those are already in motion to overwhelm hospitals that are already strained and what they're dealing with based on cases that they're seeing today. So this is only going to get worse. And what we know is that when hospitals get overwhelmed, they very quickly pivot to crisis capacity mode. And that is where, we are basically running around, chickens without a head and trying to do as much as we can. And, I'm not a physician. I am, I'm in the research field. And while I'm on the front lines helping our physicians and doctors, what I do a lot is with epidemiology and the public health. And so I have a very large role in the contact tracing program that we have, along with supporting all of our service lines in the hospitals, in the post-acute nursing homes, in the ambulatory care clinics. And what has been just so exhausting is that with healthcare workers, you can add as many hospital beds as you need, right? So you know that you're going to have an influx of another 10,000 patients in the next 2 weeks. You can bring online hospital beds. You can bring online supplies, but what you can't bring online is more staffing, and that is where rubber meets the road. If you don't have healthcare workers manning these beds, then those beds mean nothing. And we have a very finite pool of healthcare workers around the nation, and it's compounded by so many different factors. If you actually look into the staffing aspect of it, the current administration that we're in and their anti-immigration rhetoric, we took a big hit of healthcare workers not coming from overseas. So before the pandemic even started, we had a lot of medical professionals coming from international landscape to the United States to augment, a lot of our healthcare worker needs. If you look at the data before the pandemic even started, we actually had much fewer people coming in from those countries, helping augment the staffing here in the healthcare space. So that right off the bat, was a really bad signal. And then on top of that, because of the anti-immigration rhetoric, people that wanted to come to the United States and work in these hospitals and healthcare services, they were deterred to do so because of everything that was happening. And so there's so many different aspects that have been playing against us before this pandemic even started. And so in that particular article that you mentioned in the Atlantic, what I'm referencing is that, you know, it's the staffing that makes or breaks any type of response. And that is the biggest asset to any healthcare system. So again, you can have as many supplies, as many beds as you want, but if you don't have the staffing to go along with it, that is where, you know, you're going to take a huge hit. And when the number of patients increase and the number of providers decrease, you can just imagine what happens in that particular scenario yourself.
So Bob had a question, and then Anthony and Ray.
And very quickly, Doctor, we were hearing in the news this morning that the CDC, I believe, is a federal agency now telling people do not gather next week on Thanksgiving, 1 week from today. Is that true? Is that what you're hearing? And do you really think people will adhere to that?
Yeah, so, you know, the CDC is certainly our pioneer agency when it comes to providing public health guidance. And they have been doing that from the beginning of the pandemic. It's just, unfortunately, we haven't been able to hear from a lot of our career scientists in the media to provide more direct communication to the general public. And so what you saw today in terms of their briefing was something that they haven't done in months. And this is something based, so in my experience, I've responded to many different infectious disease outbreaks, and CDC has always been front and center. During Ebola, during Zika, during, you know, H1N1, you know, you always see CDC front and center. You see them on the media, you see them holding different calls with clinicians and public health providers. And because of everything that has been going on, and I don't have to get into the politics, but you know, I'm sure everybody's aware of what it was experiencing, but, you know, they were sidelined and they were silenced and siloed. And so finally today they came out with pretty aggressive guidance stating that no one should be traveling this Thanksgiving because the entire nation is experiencing very high levels of community transmission. And there's so many different reasons why you shouldn't travel, not just because you're putting yourself at risk, but you may be seeding outbreaks in these other places. And so if you have COVID-19, you are now traveling to another area and then seeding outbreaks in those particular communities, let alone exposing so many other people. And so this is certainly not the time to travel. This is certainly the time to be responsible, to stay local. And when we talk about, you know, celebrating the holidays, there's so many creative approaches to do so. And in my most recent tweet, I think just yesterday, you know, I had mentioned, you know, celebrate Thanksgiving via Zoom today, so you don't have to have an ICU Christmas, because that's exactly what we're going to experience. If you get together this Thanksgiving, and as I mentioned, there is a lag in terms of when you see individuals infected, when you see them hospitalized, and when you see them succumb to the disease, that's a good 4 to 6 weeks. And so if you celebrate Thanksgiving in person, you're putting yourself and others at risk for an ICU Christmas for, you know, 4 to 8 weeks from now.
Anthony, did you want to ask your question?
Yeah, thank you, Doctor. So I wanted to ask about schools because I've been watching, like, New York is planning on closing their schools, and I've also been hearing arguments that schools spread less than other areas, and there's also, like, in other countries, schools are still open. So I wanted to get your thoughts on that.
Yeah, so, you know, the schooling certainly is a huge priority. I think that looking at the data and looking at cases, children certainly are not spared from getting infected with COVID-19, but certainly they have a lesser chance of having a severe outcome. And so data shows that, and we have also seen that the number of children infected with COVID-19 has skyrocketed since schools have opened. And so we want to make sure that when schools are opening, and they are open, that the environment around them is also safe. Because if you have high levels of community transmission in a given community, then obviously you're going to see a number of cases within the schools. And so, you know, there's a lot of guidances out there of ensuring how to make sure that we have low levels of community transmission of COVID-19. The one thing that I'll mention is everybody is looking for this magic bullet, right? Everybody is looking for this magic intervention, and you do, and COVID-19 will go away and we won't have any more infections. And as simple as the interventions that public health have been talking about, these non-pharmaceutical interventions, that is what works. And when we tell you to wear a mask, when we tell you to physically distance and keep a distance and wash your hands and have good ventilation, there's a reason why everybody constantly says that because these are the measures that is going to help drive down community transmission. These are the simple measures that everybody can take to help with the pandemic. And so if we are able to, abide by these public health guidances, and on top of community elected officials and public health being able to prioritize activities that are more meaningful to society. So for example, bars should be closed and schools should be open. We need to prioritize those activities that are more meaningful, that have more gain and benefit over, indoor dining and things like that. So we have the information, we know what to do to help drive down community transmission. But as each state is responding on their own. And so how they're responding and what they're doing is really on themselves. So that's what I'll mention. But there is a lot of information on how to open up schools safely and effectively, and the number of cases that we're seeing in school districts.
So I'm going to go to Megan's question next, because she has a question about dining, and that pertains to your comment on indoor dining and prioritizing things like schools. Go ahead, Megan.
So I had a question because I know right now a lot of places are doing the al fresco dining, and recently it's starting to rain and it's getting really cold. So people are starting to put up tents. Like I know specifically in San Jose, San Pedro Street is planning on putting in a big, huge tent to cover the entire outside patio. My question there is really, what are the differences, or how do you feel about that? Because to me, I kind of look at it, it's like now you're putting a enclosure over the patio. So is that kind of the same as like being inside with limited capacity dining?
Yeah, so I think the most basic answer is that any enclosed space is not something that is conducive and doesn't count as outdoor dining. Outdoor dining means you have, at least a wall that is open where you have good ventilation. The key that we're trying to do is good ventilation, right? Because if you have poor ventilation, confined spaces, crowds, those all overlapping factors are basically super spreading events. And so any type of dining that is done outdoors that at least is open and has ventilation, that is what we're looking for. So you're seeing a lot of these restaurants obviously are completely closed, having all four walls on top of a closed roof. That's kind of defeating the purpose.
So next I'm going to go to Ray, who had an earlier question about mental health and healthcare workers. Go ahead, Ray.
Hello, just want to apologize in advance if I start lagging because I am on the road. But this is about mental health, and I just want to refer to a story I read, probably really in the early quarantine, where a doctor, I think in New York, she actually committed suicide because of the overwhelming stress from COVID. And I wanted to ask you, how much resources and should the health industry put resources into mental health for frontline workers? Because I could, from reading that story and kind of getting off of just my own personal opinion, I think that people dealing with COVID and their patients and people dying could definitely have a toll on your mental health for sure.
Yeah, no, mental health and psychological support is so important for frontline healthcare workers and anybody that is responding to this war-like scenario that we're in. That's exactly what it is. We're at war with an infectious disease. One thing that I'll mention regarding that is here in New York City, being the first epicenter, we had a lot of support from the Department of Defense. We actually had a lot of military doctors come and help augment our staffing in our hour of need. And we learned a lot from some of their activities in terms of what they do to support, their workforce. And they help provide some of the activities that they're doing in terms of supporting, their workforce in terms of this battle buddy system. And this is actually something that my healthcare system just implemented a few weeks ago. And what it is they started this battle buddy program, and I have a battle buddy. And what this is that it's all based on mental health and providing psychological support. And they want to make sure that because mental health is just so front and center, and so many of us are experiencing this post-traumatic stress disorder and anxiety and depression because of what we're seeing, what we're experiencing, and how we're constantly working around the clock and responding to COVID-19, you have this one person that is very similar to what you're doing, and it's something someone you can open up to. So every single day, me and my battle buddy, who's from another facility within our healthcare system, we just check up on each other. We talk about how our day went, what we're feeling, and how, we can just help each other. And it's just a simple act of just talking to somebody and just letting out all of our emotions has helped dramatically. So a lot of us have battle buddies, and this is something that the military had instituted that healthcare systems are now using, because again, this is a wartime type of scenario. So a lot of healthcare systems are looking into and supporting and providing services for frontline providers on mental health. You may not hear about it, but certainly it is happening. A lot of healthcare systems are doing it around the nation because they know this is a service that is in dire need. And then a lot of healthcare institutions are also implementing this battle buddy type of program, as I mentioned. And so it's really, really important. And I've always had, a group of individuals that I have always gone to just to air out my feelings, to talk about what is happening, what I think we can do better. And I know this is a secure forum of just a group of people that I trust, that it's confidential. It's the Vegas rule, what happens here stays here. And so a lot of us have our own internal groups on top of any institutional services that are being offered.
I feel like that's so important, and that's something that a lot of people might be able to apply themselves, especially people who can't afford therapy right now or don't have health insurance, people who, just need to have somebody who's like, I'm your designated person that's going to go through this with you, and we're going to let each other hash this out. So I'm going to go to Ariana's question really quick. She has a question about COVID preparedness. Ariana?
Hi, doctor. I just wanted to ask, your suggestions for preparing for the next pandemic, because obviously we felt like the country wasn't prepared before COVID-19 hit. So for future reference, what would you say for the country to be better prepared for something to happen like this again?
Yeah, so I think from a healthcare delivery standpoint, we look at preparedness from a 4S approach, right? So when you look at preparing for any type of an infectious disease, whether it's COVID-19 or when we talk about all hazards, it could be a coastal storm, it could be a snowstorm, it could be flooding. We always look at preparedness from a 4S approach for healthcare delivery systems. And the first S is staffing, right? So staffing is, how can we bulk up staffing? We know that in preparation for these incidences, you're going to have a lot of patients present, again, whether they're coming in with an infectious disease or it's a flooding incident and they've been displaced or whatever the case is. And so how can we augment staffing? So a lot of planning is happening in terms of what we can do for staffing. The big change that we're seeing now is because the entire nation is on fire with COVID-19, none of us can share resources. So we can't have nurses and doctors come from Texas to New York City and vice versa, because everybody is on their own. Everybody's facing their own epidemic. So we have to get creative in how we can augment staffing. So does this mean that we take dentists and other types of, doctors and train them into doing certain tasks? Do we take, OBGYN doctors and train them on how to help support ICU doctors? And so those are some of the creative approaches that are happening across the nation. So staffing is the first one. The other S is space. How can you create more space in a healthcare system to accommodate more patients? Because as you know, every hospital system has, X number of beds. And so if you have more patients coming in, how can you add on more beds, and where can you put these beds? So space is a big consideration. Where can you flex space? Can you use ORs and put beds in there? Can you retrofit waiting rooms and lobbies and put beds in there? And when do you look outside your healthcare system of putting patients in tents or other alternate care sites? So those are other considerations that we're all planning for across the nation. The other S is the supplies, right? So can we get more ventilators? Can we get more PPE? Can we get more equipment that we need? So how can we procure more of these supplies to go along with these beds? Again, a lot of planning happening there. And the last S is the system approach, right? We're all operating through almost a coordinated system. So if my hospital gets overwhelmed, at what point do I start sending these patients to another hospital? A lot of this is called what we call level loading, right? So if one hospital has reached their capacity, for example, how can we then transfer them over to another hospital? So through a system approach or coordinated approach, how can we share these resources and coordination? So that is all happening around the nation. In fact, I'm also part of NETEC, the National Emerging Special Pathogen Training Education Center. We've been providing technical assistance to healthcare systems around the nation. And one of my most recent calls was with a healthcare institute in another state that's surging, and they wanted to see how can they implement field hospitals and what did New York City do that they can learn from. So we're all very much collaborating and trying to share our experiences and say, well, this is how we've done it, and this may be of use to you. So everybody's in this planning phase, and everybody's also in the response phase. So, you know, emergency management has multiple phases. It's preparedness, it's response, it's mitigation, it's containment, it's recovery. You can be in all of these phases at the same time. Many of us are in multiple phases, and all of them require separate actions.
So unfortunately, Dr. Madad has to leave us in about 20 minutes because she's very busy and her work is very important. So I'm going to try and get as many questions in as I can. But I want to go back to Madison's question about politicizing measures like wearing a mask. Madison?
Hi. So you touched on how politics have affected the virus earlier, but I wanted to ask, what do you say to people who, you know, have politicized these precautions and refuse to wear a mask? And do you think that there should be harsher punishments for people who do put others at risk?
Yeah, so, you know, I think the one thing that we all need to perhaps look more into, and I think one of my colleagues, who I've never met, but, you know, we've interacted multiple times through different, you know, social media avenues and things like that. And she's doing an amazing job. And you can look her up as Julia Marcus. So she's from Harvard. And she talks a lot about, you know, making sure that we are interacting with individuals through risk communication, that we're doing it in a compassionate way and with empathy, and to blame people to do that they're not doing certain things, or they've done something and they put others at risk, just only perpetuates the problem. To be honest, I have a hard time myself. You know, I have always been someone where, you know, if you need something to be done from a general public standpoint, especially if you're putting other people at risk, then there is a law enforcement component to it. You know, that if you don't wear a mask, then you'll get fined. You know, it's just as simple as that. But it's not as simple as that, unfortunately, because shaming people and you know, blaming people certainly does not do any good. And so her method has been really, really well heard, something that I certainly try to look into more. But mask is something certainly that has been politicized from the very beginning, and it's been very, very unfortunate. And all of the epidemics that I've responded to, and I've mentioned this so many times in multiple different forums, but I'll mention it again here if you haven't heard it. So for those of us that have been in this particular field of outbreak science and we respond to infectious disease outbreaks, we always have to respond to two outbreaks at the same time. We are responding to the contagion itself. So whether it's COVID-19, Zika, Ebola, flu, whatever it is, we're responding to the actual threat, the contagion. And then simultaneously, we're also responding to the contagion of misinformation. And this is something that isn't new. This is something that we've always experienced in all the different epidemics and pandemics that we've faced around the world. And because we live in a world where, you know, you have social media and you have all these news outlets and people are just looking for information right away, misinformation is always front and center in any type of epidemic that we face. What's different in COVID-19 is that it is being propagated by the federal government itself. And so usually in the epidemics I've responded to, the federal government has always had a science and public health-based approach, and they've always tried to be reliable and accurate and timely. And that has not been the case in this current pandemic. In fact, if you look at some of the studies, I forgot what institution actually did the study, but the New York Times did a piece on it, and they looked at the misinformation and the disinformation that has been propagated in this pandemic. And one person in particular was responsible for 40% of the misinformation. And I think everybody can probably know who I'm talking about. But this particular individual politicized mask wearing, the use of hydroxychloroquine, and really just put a lot of misinformation, disinformation out there. And it was all traced back to this one individual through the study to show you the power of misinformation, disinformation. And the one thing that I'll mention is that when you have misinformation, disinformation, it's not just about reading something that is false and then just leaving it. It has consequences. It has repercussions. And again, you see other studies that have shown that a number of people, thousands of people have been put at higher risk because of this and even died because of misinformation. And the reason for that is that they believe that, for example, hydroxychloroquine works, and they take it and then, you know, they're using it for a purpose that doesn't exist, and they're putting themselves at higher risk of a severe outcome. Other people think that masks don't work, and so they're not wearing a mask, and they go out in public and they get infected with COVID-19, for example, and they may have a severe outcome. So not only does bad information, pollute your mind and make you believe in junk science, but it actually puts you at higher risk for disease, and it puts you at higher risk for death. And that has been documented. You've actually seen thousands of cases die because they had read misinformation and put themselves at higher risk. And so this is not only a threat, this is a national security threat. Misinformation and bad information is a national security threat because it's putting so many people at risk, and it's very, very unfortunate.
So Daniel has a question about the vaccine. Daniel?
So everybody has their speculation on the vaccine, and a lot of people are worried about it. How do you feel about the vaccine, and should we be taking the vaccine when it comes out?
So I am extremely hopeful, and and when I look at some of the studies and the press releases that have been made available, certainly I'm very pleasantly surprised at the efficacy of these vaccines, and knowing that this is something that's going to be made available fairly soon. And if you're following up with the vaccine news, the general public is not going to have access to this right away. There's priority groups, and so when the public is going to see this is sometime next year. But certainly, I think this is really good news on the vaccine front. Certainly, I think vaccines have the potential to end the pandemic. And the reason why I say the potential is because it's not just about the vaccine, right? So vaccines don't save lives. It's vaccination that saves lives. So a vaccine is great, but if no one's going to take it, well, it's just going to be sitting on the shelf collecting dust. And so the big problem we now have is making sure people actually get vaccinated, because that's where it counts. And we have invested billions of dollars in developing a safe and effective vaccine. And we've invested $0 in actually people getting vaccinated and making sure that they have the information, that they're educated, and we're doing a good community outreach to make sure people get the vaccine. So there's a lot of work that needs to be done in terms of making sure that people have access to these vaccines, that it's distributed equitably, that people feel confident in actually getting vaccinated. And that's where we're going to start struggling to make sure we can operationalize this to the full extent possible. And all of us have plans. Every state has a plan, but plans are all on paper, and this is where we really need to operationalize it and invest more resources into the operations of giving a vaccine. So that's what I'll say on that front. I do want to, I'll take one more question, and then I do want to end with providing some additional information. So I'm happy to take one more question, and then I'm going to wrap up by giving some tips before we end today's conversation.
That sounds great. Let's go to Alejandra's question. And then, Doctor, would it be okay if I copied some of these questions down and asked them to you in email later?
Sure. Certainly. If I have time, I'm happy to answer.
Okay. Thanks so much. I know you're very busy. Alejandra, your question?
My question was in regards to the face mask. Do you believe that face shields should continue to be sold, even though they have shown to not be effective? Because like when you cough, it gets around everywhere, or simply the filter, it doesn't have one? Or do you believe that the common mask should be sold as well? Because I know that some of them, they're just like the cloth, it doesn't have the filter, but a lot of people use them as well.
So I think there's a couple of questions you'd ask there. So first, face coverings work, masks work. Not all face masks are created equally. But certainly on the notion of do masks work, absolutely. There are different types of masks that are made available out there. You have 1-ply, 2-ply, 3-ply cloth masks, medical grade surgical masks, N95s, and they all have different effectiveness associated with it. They all are effective to a certain degree. CDC has information on what cloth masks work best. So you want to have something that is 2 layers at the minimum and going from there. And so wearing a mask is really, really important. Now, should you only wear a face shield instead of a mask? No. And again, CDC also has information on there of why that is. And as you alluded to, these are droplets and aerosols that are all around us. And so they can certainly obviously creep up from underneath your face shields, and they're not giving you that full protection. If you want to wear eye protection on top of your face mask, certainly that is an option, but just only relying on a face shield and not wearing a face mask, that really defeats the purpose. So I think that's on that. I think CDC and other organizations have some really great information on the type of face masks to wear, how to make one if you're making one, And they also, the important thing is, you know, how to take care of these face masks. And what I'm seeing a lot of times is, you know, people are wearing the same face mask over and over and over again. Really important to look at the hygiene of these face masks and to make sure that we are handling them, storing them, and washing them appropriately, and, you know, following the public health guidance. So I think the last thing I'll say is certainly face masks work. And the one thing that I often hear is, well, if I'm wearing a face mask and I know it's only, you know, 40, 50% effective, for example, that defeat, you know, then I'm not going to wear it. And there's two things to that. So first, you know, if somebody is at increased risk for heart disease and the doctor gives them a medication, they're taking medication, you know, for heart disease, that medication is not going to prevent you from having a heart attack. It's going to help decrease your chances, right? And so very similarly with the mask, you're not going to throw your hands up in the air if something is not a 100% effective. It's giving you a form of protection. And so it's certainly a really great barrier. And this is where that Swiss cheese model comes into play. And so you need to add on more layers. And so when we say wearing a mask and physically distancing, we're not saying that wear a mask and go ahead and go mingle with people and hug and kiss. You want to add on another layer of physical distancing, because the end goal is how to decrease your risk of contracting and spreading COVID-19. So the more layers of intervention you can add, you're decreasing your chances of obviously spreading COVID-19 and contracting COVID-19. So wearing a mask is one thing. It's not 100% foolproof, but it does a great job. Physically distancing is another layer. So you're adding on, you know, additional preventative measures, washing your hands, not going to crowded spaces, making sure there's good ventilation. These are all different layers that you want to add on with the ultimate goal of obviously decreasing your chances of contracting and spreading COVID-19. So with that, I think what I'll end with is just a couple of things. So first, you know, my takeaway is three things. Very simple, very basic. Again, I'm sure everybody has heard this multiple times. But, you know, we obviously are in the most crucial period in this pandemic across the nation. So regardless of where you're living, you know, there are increased number of cases all over. And so, you know, you heard a lot about wearing a mask, wash your hands, watch your distance, good ventilation. I'm sure everybody's like blue in the face from hearing that, but, you know, you can't say that enough because those are the measures that work. But the other thing that I'll mention is my three takeaway is first, stay aware of public health information, right? So regardless of where you're living, always stay aware of public health information, because this can be different from one jurisdiction to another. And you're seeing states implement different types of restrictions. So bars may be closed, businesses may have a curfew, things like that. So just really important to just stay aware of public health information that is happening around you. And what I'll mention in that is make sure that you're going to credible sources when you're getting your epidemic information, right? There is a lot of misinformation out there. And I recently published, and you're welcome to read on this further, is how to, you know, evaluate, you know, sources of information. So if you're going to a website, for example, you know, how do you know this is a reliable source? You know, how do you know that I'm getting true information? And so the method that I proposed is kind of the 5 W's, you know, so basically whose website is it, right? The first is the who. So whose website is it? Is it an individual's website, or is this a public health agency's website? So look at whose website it is. You know, what is the source that they're offering, right? So are they citing scientists and data, or are they citing, you know, their own opinion, right? Look at, you know, when this information was released, right? So you want to make sure you're going to websites that are kept up to date. There's so many websites that have information from March and then they're not updating it. So you want to see when this information was updated, you know, and then why are they sharing this information? So what is their goal? What is their aim, right? And then lastly, you want to see where are they getting this information from? So evaluating your websites through this 5W approach, as simple as it is, you know, the who, the what, the when, the where, and things like that. That's how you can know you're going to credible sources to get your information. So obviously, you know, staying aware of public health information is really important. The other thing I'll mention is staying prepared, right? And so again, we may not see national lockdowns, we may not see shelter in place uniformly, but because cases are increasing across the nation, you always want to have an in-home emergency kit. And this is good, not just for infectious diseases, but this is for coastal storms and all hazards. It's always good to have an in-home emergency kit, because you never know when your given community has so much infection that your elected officials say we're going to do shelter in place again. So always make sure that you have a good in-home emergency kit. And the way that I do it is I write down every single person in my household and I see what do they need for the next 2 weeks, right? I have a baby. She requires more essential items than my husband. You know, she needs diapers and wipes and all these things. And so I make a list of things that I know that, you know, are essential items for each individual. And I'll make sure that I have a good, 2-week stockpile of those items. It could be for medications as well. And the last thing that I'll mention is stay engaged, right? And so I think we've alluded to the mental health impact that this pandemic is happening. And so really important to stay engaged with friends and family and your loved ones. No one should feel like that they're alone, that they are experiencing this by themselves. So whether you have a battle buddy or you have your own, social network that you want to tap into, but really, really important to just, continue to stay engaged, with your loved ones and those around you. So with that, I'm happy to, just kind of close out today's session, and I'll hand it back to you. But I hope that I answered some of your questions and given you some tips to take back.
Thank you so much for being with us and for giving us your time. We know it's very valuable, and thank you so much for all the work that you're doing. It was an honor to speak with you today.
My pleasure. Thanks for having me, and stay safe, everybody, and stay healthy. And thanks for obviously doing your part. Everybody has a role to play in this pandemic. So certainly, stay the course, and there will be light at the end of the tunnel.
Thank you, Doctor. We greatly appreciate the time. You stay safe and have a great holiday season.
Thank you. You do the same. Happy Thanksgiving, everyone.
Thank you so much.